2 years after the world saw its first case of COVID-19 and more than 5.3 million deaths, a cure for the infection is yet to be found. This is something which troubles the minds of the researchers, scientists and traditional medicine practitioners in this room. They say suggestions, medicines and protocols developed by them are not given considerations by the Nigerian government and are ditched for unproven foreign remedies.
Your Excellency, during the last 1 year, it has been a trying period because COVID is here with us. But what is happening globally is science. Those who say they have the cure have the greatest level of infection. It's totally unscientific. Those who say that they are able to distribute what they have are trying to not be very generous with it. And I will urge our country to keep trying to see whether those of us or those of our brethren that are on vaccine production should also be encouraged so that they can have our own ingrown, homemade answer to the vaccine issue.
Some British persons got infected with COVID, and apparently they have had our product. They took the product as an immune support that time when they visited Africa. And when they had COVID, they compassionately took it and recovered and wrote us a letter that this is a cure for COVID. And we have it here, Mr. Minister, we're going to submit that to you.
They further called on the government to re-examine the foreign solutions adopted for use in the country.
But a question that still baffles science is a vaccine that does not prevent you from having the disease, a vaccine that does not prevent you from transmitting the disease, a vaccine that only helps you from dying from disease. How can it be a public health issue that requires mass vaccination? This is something the government has to cleverly and carefully look into.
The group will take solace in the encouragement by the minister, who assured them that all solutions and complaints raised during the meeting will be objectively investigated.
We want to assure you that the Federal Ministry of Science and Technology, Federal Ministry of Science, Technology and Innovation will support you. We will support you. We are going to support you. The protocol for clinical trial on phytomedicine, medicine derived from our herbs and natural compounds, that protocol has been developed. We would like to look at it. And we will try to ensure that these trials are conducted.
Since the COVID-19 pandemic began, Nigeria has relied on foreign recommendations for testing, treating and prevention of the infection. The country has adopted products of international pharmaceutical and biotechnology companies such as Pfizer-BioNTech, AstraZeneca, Moderna and Johnson & Johnson. Critics say this may be partly responsible for the vaccine apathy which has greeted the process, with less than 5% of the nation's population vaccinated. Ferdinand Duruoha, Arise News.